Hello, welcome to my restorative physical therapy. Today we're going to be talking about hip impingement. So, impingement, what is it? Impingement is the fancy medical term for pinching. Another structure is hitting another structure that should not be. When it comes to hip impingement, we talk about three different types. There is cam impingement, pincer impingement, and combination, which is a combination of the two. So cam impingement is when the ball of the hip is not shaped properly, and so when you go through certain motions, it ends up kind of impacting the front of the socket, which can be pretty uncomfortable, as you can imagine. The pincer type of impingement is when the socket has kind of over coverage. So it is extending out too far, which means the same result happens. You have excessive impacting when you try and move. And the combination is when you have both the abnormal shape of the head of the femur, the ball part of the joint, and you have over coverage at the socket as well, which makes it more likely that you'll end up with these pinching sensations. So what are the hallmark signs of this? Typically anterior hip pain with deep squats or end-ranged hip flexion. So when you bring your thigh to your chest. So this is pretty common in weightlifters that like to do deep squats. This can be a little bit confusing discerning labral dysfunction and this hip impingement. And kind of the biggest things are, with the labrum, you're going to have the clicking and more the rotatory component, so difficulty with rotational movements and such. You'll still have anterior hip pain and you'll still have some difficulty with hip flexion, but the labrum is more with the clicking and the instability, versus impingement is more anterior hip pain with deep squats and a blocking feeling of motion rather than any kind of catching or instability. Signs that you need to see a doctor when you have hip impingement are your range of motion is very significantly blocked. When you are at that stage, it's a good idea to see the doctor and maybe discuss surgical options to see if we can get a better shaped ball and socket. So just changing the contours of the ball and socket so that way the hip moves more freely and you stop impacting a bone onto another bone. And then the other thing that I typically say is if your anterior hip pain is very severe, so if it's pretty sharp and you have bones that just aren't fitting together properly and moving together properly, having that discussion with the doctor to see if a surgery would be right for you. But if you do feel like your symptoms are mild and you feel like getting started with some top tips and exercises, you can head on over to the tip sheet now.